Hello, welcome to the Wellness Room. I am Stephanie Watson at Omaha Integrative Care, and this is Kayla Meisinger. She's one of our nurse practitioners, psych nurse
Hello.
practitioners, and we were excited to have her here. We have some questions for her, but we thought we would start, Kayla, by just asking you, what do you do here, and why are you passionate about your job? Maybe how did you get into it? That's always exciting. Just tell us about it.
Yes, thank you. And thank you for having me on here. So like Steph said, I am a psych nurse practitioner. I would say I got into nursing initially, like nurse practitioners do, and then I've always just had this like passion for mental health.
Mm,
It's started in childhood, I think, because I struggled not even knowing it at first with my own anxiety, and then like family members that had anxiety, friends that had different mental health issues. And I feel like I was just kind of like always a go-to person and um like have always been like extra supportive towards those kind of things. So it like naturally pulled me to this area. I think it was just kind of meant to be.
Is there a reason why you went that route instead of a therapist route? Or did you ever
I
think about being a therapist?
I did think about being a therapist, but like I guess I just chose nursing because like m the medical side of things has always interested me as well.
Okay.
And like I
Okay.
always loved science. Like or science, I feel like I excelled in science for the most
Okay.
part. And then also just like I've seen how big of a impact medications can make for people. So I have always thought it would be so cool to be able to be on the prescribing end of that.
Awesome. Awesome. Okay. Well, that's cool. I mean, I didn't know that about you. I didn't know what I always like to hear why someone gets into what they're doing and what the path
Yeah.
is. Okay. So working at Omaha Integrative Care, and you've been there, how long have you been with us?
So this fall, early fall, it'll be 2 years as a practitioner. And then I was here as a student for almost a year and a half with our other nurse practitioner, Allison.
I remember that really well because
Yes.
the first thing I noticed about you were your awesome shoes. Do you remember those conversations?
Yes.
So fashionista on the side. Okay, so I know that when someone comes in to see you, there are probably some hurdles and steps. And it
Mhm.
makes it sometimes difficult for someone to make a choice to come in and maybe discuss medication. Can you tell me more about what those hurdles might be and then maybe demystify them a little bit so people can start to feel a little more comfortable in having those discussions with you?
Yeah, I think like the number one is like just the stigma and like automatically thinking like I don't want to be on medications. I hear that from a lot of my patients. Just like I've been putting it off, like I wanted to do it the natural way first, which I respect that. Like I totally agree. Like if you can, like less is more, the more you can do from a natural standpoint, like exercise and fixing diet and decreasing external life stressors and doing like mindfulness practices, yoga, seeing a therapist, those are all great. And for a lot of people, those are enough, and that's wonderful. But then it's when those things, you're doing all the right things and you're still not feeling good. Like you're still not
Mhm.
feeling like the best version of yourself, whether that be anxiety or depression. For some people, insomnia. It's a lot of things. Or then like with the mood disorders, if you're having these episodes with impulsivity, stuff like that, I could go on, but like you're doing all the right things, but you're still not seeing the outcomes that you want to see. And that's when medications kind of come into play. And I like
Okay.
to describe them as a tool, right? Like they're not a band-aid, the end all be all. They're not going to fix all your problems. But if you add them into what you're already doing, they can make a world of difference. Like,
Right.
and I don't think people realize that until they officially start the med and they're like, oh my gosh, why did I wait so long to do this? Like, I feel so much better. And that's like my favorite part of my job is that follow-up appointment where people are like, oh, like I didn't even know I could feel this good. And it just makes me so happy.
Kayla, do you notice that if someone takes medication and only does that, a difference between the person that might do it all? And I mean, not in an overwhelming way, but let's say they take medication and they're eating well and they're exercising and doing all the other things that we know are great for your mental health and wellness. Do
Yeah.
you see a pretty significant difference?
Oh, 100%. Like
Okay.
without even thinking about it, definitely. Yes. Because like there's so many components to wellness. Like I said, meds aren't like a end all be all. They're not going to fix everything if you're not eating right, if you're not exercising. Like those are things that are still going to show up some way in your life in a negative way. Like the like nutrition,
Right.
movement, connection with others. These are all things that as human beings we need. So medications are still going to help, but if you're able to do those other life changes, there's so much more potential for growth and just feeling better for sure.
Is there a candidate that would not be a good fit for medication for a mood disorder? Guess
That's
I
a
should
tough
make.
question. I mean, I guess it's all like I like to tell people like you are the boss here and at the end of the day it all comes down to what you're willing to do and your own consistency. So if you are against taking medications and you're not going to be like consistent with taking them, then yeah, like you have to meet yourself where you're at. If you're not going to do something, you can't force yourself to do it. And then of course, like, there's so many meds out there. We trial and error with
I was going to
some.
ask you that. I know that I have read about many. It's hard to keep up with what
Mhm.
the newest ones are.
Yes.
I always think back in the day, like Prozac Nation, that book, and all the different
Yeah. I still use a lot
SSRI.
of Prozac. I still
Yeah,
think,
it's still out there and it works for
yep.
a lot of people. So yeah, give me like the top three and like just a really like layman's terms, what's the difference? And
Between the meds.
yeah, like if what are like the top three that people are prescribing and like is there anything that you would say really makes a difference between those three?
Yeah, so honestly, it depends on what you're coming in with. So, like, if you come
Okay.
in and like anxiety is a huge problem, and
Mhm.
it sounds counterintuitive or it doesn't sound right, but the gold standard treatment for anxiety is an SSRI, which is
Mhm.
selective serotonin reuptake inhibitor, which that's like the most widely prescribed medication in the psych world, I think, out there.
Okay.
But that's like the number one treatment for both anxiety and depression. And there's all kinds of different SSRIs to choose from. There's Prozac, there's Zoloft, there's Lexapro, there's Celexa, there's Vilazodone or Vibrid. There's now
Wow.
Trintellix. That's a newer one. There's a lot.
Yeah, those
Um,
last two I hadn't heard of. So there's quite a few. You mentioned anxiety and depression, and I want to
mhm.
back up to that because I've heard this before. And tell me if this is what you've experienced or if you know any science behind this. That
Yeah.
often if someone has one, they'll have the other. Is that true?
Not always, but yeah. Like I tell people they're kind of buddies. Like when
No,
one
it
shows
really
up, the other one likes
stinks,
to be there
right?
too. But not always, like there
Yeah,
can be one without the other. But yeah, it's odd. And so like I think in the actual world of science, we don't have a perfectly clear understanding of how most psych meds work. We know the basics, just because it's really hard to get in there and study the brain. You kind of like in a living being, you can't
right.
actively study what's happening. And the brain is way more complex than I think anybody even knows.
So if
Um,
somebody has anxiety and or depression, is it fair to say that they're low on serotonin and endorphins and that the medication, that's why medication's helpful because it actually supports the increase of that? Like I don't know, is it through your what is it your pituitary? I'm not sure where it even comes from, but is
there's a
that
lot
fair
of
to say,
studies.
right?
I mean, it's mixed evidence from the like in the
Okay.
literature out there. There's some show like we know there's some kind of imbalance going on. As for if like every case isn't necessarily you have low serotonin, but for whatever reason we know that the SSRIs work in one way or another.
Right.
They just work by binding to your serotonin receptor, which prevents your brain from reabsorbing that serotonin back up into your body, which makes more available for your brain to use.
Hmm.
But yeah, our brain is very interesting and complex.
I mean, the research is hot around it, right? Because,
Yes.
then there's all these other things that are end of life for people that they still don't know a lot about, like dementia,
Yeah.
Alzheimer's, and some of those can be linked to lifelong battles with, unfortunately, depression and anxiety that was untreated. So
Yeah,
there's quite a bit
100%.
out there. Um, is there anything like I know for quite a while, Sammy has been something that people have used. Have you? That's like a natural supplement for depression. Have you seen that work, or is there any other things that, and I know supplements aren't always regulated, so, we're in
Yeah.
territory that you may not be able to like, talk a lot about because it sometimes isn't FDA regulated. But
Yeah.
anything that along those lines that you think have been helpful for someone who might be hesitant
I've
with?
heard a few people try Sammy,
Mhm.
and I've heard very mixed results. Some
Okay.
people have said like it has worked really great for them, and that's awesome. But
Hmm.
like you said, like the exact regulation on them is very mixed. Some
Right.
companies do a great job at like third party testing and ensuring the like exact dose is going to be in there. Other supplements are really up in the air with that. But that and then St. John's wort, that's
Yeah,
another
that's another
one
one. Yeah.
that's been around. It kind of works similarly to an SSRI, allows more serotonin in the body. But that one is hard too. It's an herb and it's hard to get exact measurements sometimes and like exact dosing like we do with prescription medications. But I'm a big fan of supplements. I
I
love,
am too.
like you should see my pill organizer.
I mean, we could probably have a lot of fun together. I'm always fascinated by the latest research and and I'll go that
Yeah.
route often before I'll go another route. I mean,
Oh
why
yeah,
not?
same.
So,
Yeah.
um, I was wondering, is this something you need to be on for? And I kind of know the answer, but I want to hear more from you. Do
Yeah.
I have to be on this all my life? And is there a
Mm.
danger of just going off of it cold turkey? Because I hear people doing that all the time.
Yeah, and I get this question a lot.
I
And
bet
no,
you do.
yes, and like I said before, meds are tools, so you certainly do not need to be on it lifelong, especially if you don't want to be.
Right.
So I think in the research, it generally touches on the safe period before you can start tapering off is around 6 months. So
Okay.
you take an antidepressant, it works really well, it does the job, you get back to baseline. Say you make some of those life changes, you start going to the gym, or you
Okay.
start like seeing a therapist and you're ready to kind of start tapering yourself off of it, which we'll touch on that too. You don't ever want to stop cold turkey. Um,
I figured, but you got
yeah.
to hear it from you.
Yeah. Um, but yes, if you're like, okay, the meds did their job, I'm feeling so much better, I want to come off. Great, let's try coming off. And then we do
Okay.
a taper after 6 months. I believe the most recent article I was reading about it is just saying like chemically, for whatever reason, if we stop before 6 months, there's a higher chance for uh,
Like a
relapse of
relapse
symptoms.
kind of thing.
Yeah.
Okay.
Yeah.
So how would you know? Like, I'm sure like you look for certain signs and, almost like an outtake form for the med or whatever, but how would someone know? Like, besides like, I feel great, but then there's the scariness of like, but if I go off, I might
Yeah.
relapse, like you said.
I think a big thing is looking at like what your life looks like right now. Like, do you have a good support system? Are you incorporating all of these things? Like we talked about, exercise, eating healthy,
Mhm.
having like strong connections with loved ones, seeing a therapist. Like, is work going well? Is work really stressful? Is your home life really stressful? Like, is there a health condition going on in your family? Like, taking all of those considerations in to kind of
Okay.
support yourself. So, like, if I come off right now, am I gonna do okay with this?
Mhm.
And if you can check all those boxes, I think it would be safe to try to transition off if that's what you want to do.
Right. Okay. So it's really personalized.
Super
Sounds
personalized,
like.
as is everything in mental health. There's no one size fits all. It's like
Right.
every person is very unique.
I love that. I love that.
Yeah.
Okay, so one of the things that is a hurdle then is definitely financial. Obviously, take insurance. And are
Yeah.
these meds usually covered by insurance, most insurance plans?
Most of them, and even
Okay.
if they're not, like GoodRx is a great tool to have,
Yeah, I
totally
know a lot of people
free.
that use that.
Yeah. Even if like say you don't have insurance and you're paying out of pocket for the visits, you can still use GoodRx, which is really nice.
And it makes quite a difference, doesn't it?
Oh yeah, like it
It's
can bring a
great.
med that's normally like $50 down to like $3. It can bring like a
That's
$400 med down
unbelievable.
to $20. It depends though. Like
Right, right.
can't speak on
So
all of them.
the best way is just to get on their website and look that way and then kind of plug in what you need. And then maybe they have like a generic form or something too. Might be very
Yeah.
helpful. Okay.
Yeah. And like
Awesome.
we take all of the different insurances here. I think I am certified with all of major insurances, including Medicaid and Medicare,
Okay.
uh, which is great.
That is great. So, how does someone get in to see you? Is it best way just to like, I know there's an intake form on our website.
Yes.
How long is
So,
a wait for you? Does it just kind of depend? Like, you have a pretty full
it,
schedule. So, if somebody's like kind of in
yeah.
a I mean, I feel like a lot of us wait. I know I do. I wait till it's really bad. So I always feel like I
Yeah.
can fix something myself with myself, and then I wait too long, and then it's like more serious, right? So what do we do in those situations? Do you have any advice for us?
So it totally depends with my schedule. I would say I can usually get someone in within a month.
So then intake first session with you, that's usually a little longer. And then from then
Mhm.
on, though, you have like check-ins, right? What's the
Yeah.
time commitment? Just so as people work and they have all these things going on,
Yeah.
just to know like this is not going to take a ton of time out of my
Yeah.
life, but could make a major difference in my life.
Oh, 100%. So the first visit, it's like it totally depends on just how much we have to talk about and how much you want to talk about or the patient. So it goes anywhere for the first visit from 45 to like 90 minutes.
Okay.
And that's just because I have a lot of questions. The patient usually has a lot of questions, and there's just a lot to touch on. Follow-ups after the first visit, just usual standard is 4 weeks out after starting a medication or even not starting a medication. I like to touch in and see how things are going. And
Okay.
follow-ups are also a lot shorter, like you said, give or take 30 minutes.
That's perfect. That's perfect.
Yeah. And also, like with one thing that we can thank COVID for is we can do Zoom. So for people that
That
can't get away
telehealth
from
is the
work,
best. Yeah.
yes, like hence what we're doing right now. So,
Yeah. Okay, that's
um,
awesome. And then
yeah.
what ages of how early do you start? Do you see teens, young
Yeah.
adults?
So I started
Okay.
at 13. I
Oh,
might
that's younger
eventually
than I
go
thought.
down.
That's awesome.
Yeah. I actually love my teen patients. They're
I
so
bet you
fun.
do. I bet
Yeah.
you do.
And then to however old. So it's a big
Okay.
range.
Okay, that's super cool. That's great
Yeah.
to know. What other conditions do you treat? Like, give me just a few different things that is there anything you feel like you really specialize in or you're really passionate about?
Yeah, so I see like a smorgasbord, like a little bit of everything. So depression, anxiety, bipolar disorder, some schizoaffective. I don't currently have anybody with schizophrenia, but it is in my wheelhouse.
Okay.
ADHD, binge eating disorder,
Wow.
OCD.
Everything.
Yeah. And I don't honestly know that I have a favorite. I love variety. I love getting to like work with all of the different things, but I do have like a special place in my heart for OCD and health anxiety because it's something that's like so common, I'm finding. Like I have so many people coming to me with that,
Mm.
and it's just like an area of interest for some reason. So,
Tell me about health anxiety. I feel like I have it. I
I
want
think
to
a
know
lot of
more.
us have it, and
Tell me more.
yes. So just like, always worrying that something is wrong, like the
Yeah.
somatization of like feeling the sensations in your body and that triggering worry, and then Googling and Chat GPT and checking
Mhm,
like
I
that.
know. Isn't that horrible? It's so
Yes. And
scary.
then I mean I don't have a TikTok, but TikTok is a huge culprit too. Like
Yep.
you watch
Yep.
one video and it's in your algorithm,
Yep.
like
Yep. And
cancer
then
or
then you can't get away from it. Yeah.
Mhm. Yes. And
Scary.
there's just so much information at our fingertips,
Yeah, that's
but
the dark side of the information
yeah.
that we can get is that it's almost too much. And
Yeah.
yeah, we're all
And it's scary.
self-diagnosing. And I've done it for sure. Like I
Yeah.
totally have. Yeah.
I know.
Uh,
I think all of us do to some degree. So, and when it gets kind of out of control and you start spiraling with it, that is when it can get
yeah.
so bad and so scary. So,
It is scary. So you're seeing that quite a bit. What do you
I
do? What do
do.
you do for someone who has that? What medication would you give them? Is it all anxiety? It sounds like anxiety to me, right? Is it
So health anxiety kind of falls into the realm of OCD, which is a form of
okay?
anxiety.
Okay.
It's not exactly OCD, but it's kind of like a sibling, if you will.
Interesting. Okay.
Yeah. So then uh, the gold standard treatment is going to be an SSRI, and then
Okay.
heavy on the therapy too. Like that therapy
Yeah.
component is
Yeah.
really,
Makes
really
sense.
important.
Because I feel also that some people that might have something like that might have PTSD from a prior experience,
Oh
and then the
yeah.
more that, it just brings that fear up and that
Yeah, definitely.
physiological response, it's not just all mental, it's like your body reacts to it.
Yeah.
Um, Okay, that's very interesting. You're seeing it more, but I'm so not surprised given our society now and kind of where
Yes.
things are. That brought me up another question for me. What
Yeah.
about the person who's like, I feel pretty healthy and pretty good, like stable, I do all the things or whatever, but I have major anxiety when I fly, or, just like those times where, and I'm going to say, you just feel like you need a couple Xanax to like take the edge off. Do
Yes.
you prescribe that to people, or is there something else that you do, or what are
Yeah.
your thoughts on that? Because I
I
feel
do
like I
some,
know a
yeah.
lot of people like that. They don't need it all the time. They just need it when they freak out
Yes,
under certain
that is a
situations.
percentage of my patients for sure. Like
Okay.
everything is pretty good. They don't want to take anything daily, and that's great. Like that's awesome. But then the as neededs are there for situations that are really triggering. Like I have patients who have a Xanax prescription that they haven't taken in 2 years, but
Yeah,
it
it
gives
just
them
sits there.
comfort that it's just, yeah, there.
It's almost like a security blanket, like their
Yeah.
emotional support for when they like freak out. But I mean,
Yeah.
if you've had a panic attack, and I have, it is a horrendous,
Awful.
horrible, you do feel like you're going to die
Yes.
situation. And
The
it's
world is
pretty
ending.
serious.
Yes.
Yeah.
It's a horrible, horrible feeling. Yes, I agree. But yeah, no, the as needed, there's a time and a place, and they're great. I just like to educate, like, it's just like that. Like, there's a time and a place. Not, they're not great if you're taking them like
All the
every
time. Yeah.
single
Then we
day.
need to think about something else.
Yeah, because
So are you
they come with some
seeing,
more side effects. So,
right. And I feel like there's you can, you need more. So if you're taking like a little bit and then you were taking them constantly, and I know people who've done that, then all of a sudden literally I've known people who've taken handfuls of them every day. Like that, like tons of them, and then that clearly
yeah,
there's
you
something
get
else going on.
tolerance.
Um,
Yes.
are you seeing a lot of family patterns? And that's what epigenetics, right? Of like just like it's passing down. Do you see it a lot in like
Yes.
things like I know anxiety and depression, but do you see it in things like OCD, schizophrenia? Like, are those also things that you're seeing like that? Oh, my grandma had it, my mom had it, I have it, my kid has it.
Yes.
Like, do you see it quite a bit?
Yeah, I would say it's pretty common. There is definitely a genetic component with a lot of things, and even
Mhm.
like sadly trauma. Like when people come in
Yeah.
and like talk about their trauma history, they're like, "Yeah, and my mom had that, and my grandma had that," and it's like
Yeah.
just keeps going.
Yeah, you have to do a lot of work to try and heal it so that you break that pattern, and it's just doesn't always work. But having support and help by someone like
Yes.
you, and then tell me about how you're integrating in your our awesome establishment. Like, where do you
Yeah.
like to send people? Like, it sounds like therapy
Therapy, therapy, therapy.
is your
Yes.
sister. Yeah. Okay.
Therapy
Who's your
is
twin?
awesome.
Okay, great. So you and we, I know, and I hope to get some more people on to talk to them. But over the
Yeah.
years, I just know how many awesome, really like diverse group of therapists we have that can handle pretty much anything for any
Yes.
age group starting at 3,
I
which is
know.
great. Isn't that the
I honestly,
best?
it is the best. And I think like, I think everybody should have a therapist. I just think that's such a great, especially like in like the isolated world we're living in, like I
I
just think
agree.
it's such an added aspect of support. And then also I love Omaha Integrative Care because like we're not just therapy and psych, like we have a medical component, and
I
especially the medical
know.
providers we do have are so like
They're
I
awesome.
yes,
I
I
mean,
have
they
a
really spend
special
time.
place.
Yeah,
Yes.
they really, I mean, that's where I go for my health care and my
Same.
hormones and all of
Yep.
it because
Yep.
I want that integrative lens and like a bigger picture, and they take time with you,
Yes.
which
And
is
it's
so
holistic.
important.
It's not like, oh, we'll just do the basic lab panels, which like you can walk into like any hospital establishment or clinic around here
You
and
can do that anywhere nowadays. You
yeah,
can
they'll
get an
give you the
aura ring,
basics.
go get your blood taken, and like you know what I mean? Like it's like
Yes.
which is cool. I'm not in any way bagging on any of that. I think it's super cool.
No.
I love it. It's like we have some power over our health. But I also think, and that a lot of it boils down to insurance, it's like
Yeah.
in and out super quick and you just don't get the full picture. So there's a place for everybody,
Yes.
which
And
is
it's
really
like
cool.
holistic. Like it's not like, oh, here's a med. Like here's a med for this,
Right.
here's med for that. Like there's, like so many different things that can be prescribed outside of like just medication. Like there's all kinds of different like PT, OT, and then like like, again supplements. Like circling back to supplements, I think they're highly underrated. Like there's
I
so
do
many out there that
too.
are so great. And if you
Yeah.
ever want to talk about that, I would love
I mean,
to.
maybe that's what we should do next time is talk about our
Mm.
favorite supplements.
Yeah.
I'm the same. I'm so into them. And I've been into them for a super long time. I got into them probably like in my very early 20s. And so, and on and off, and certain things for, I've had a lot of success. I also have learned too that you can overdo it. Like where I was
Yeah.
just like, so there's like a fine line for sure.
Yes.
And then when
Balance.
you change, like when I started to change, especially hormonally, then what I was taking had to change. And
Yes.
I had to learn
Hormones are
that
so
sometimes
huge.
the
Oh my
hard way you
gosh.
learn it, right? Like your
Yes.
body will tell you. Something will tell you that it's
Yes.
time to change it. Yeah,
And that's
it's
a big
pretty
thing,
amazing.
especially with women. Like hormones like dictate so much more in our lives
Oh,
than
it's
what we realize.
crazy.
And when they get out of whack, then everything
Everything does.
follows. Yeah.
It's crazy. They rule the roost.
Yeah,
They really
definitely.
do. Awesome. Well, this was super fun. Even with our little
Yeah.
tech issues, we pulled it together and we were
Yes.
resilient. Here we are, and I really appreciate your time. Is there anything else you want to add or any other thoughts before we go
I
for
mean,
now?
there's
But
so many things to talk about all the
I
time in
know.
regard to mental health, but I mean, I think we covered a lot of good stuff
I
and
do too. It's a good start. Maybe we can make a little list now, now that we like touched on things like the supplement one might be a really good one to follow up on and we can do it again
yes,
because
please. I
you're
would love that.
natural. This is fun.
Thanks.